Hi, good evening, everyone. My name is Sara Zeccardi, and I am a nurse practitioner with the University of Pennsylvania. I work there in the Department of Neurology with the headache team. And I'm here to discuss some non-pharmacologic treatment options for migraine. And so I'd first like to start by extending a heartfelt thanks to the University of Utah and the Headache School for allowing me to participate. I think this is a wonderful program and a great resource for patients. So to start with, let me see, how can I advance the slide? There we go. So here are my objectives for today. We'll talk about who could benefit from these options, some relaxation strategies, healthy habits, and then get into some nutraceuticals and a brief review of devices available for migraine. So to start, that question, who could benefit from these non-pharmacologic options? And in my opinion, it's most patients. And that's because you don't necessarily need to use these things in the complete absence of medications. In fact, some of these, especially the first few things we'll talk about, really build a great foundation on which you can build the rest of your migraine treatment plan. And then, of course, there are those patients who would prefer not to take medicines, those who have issues with side effects or costs or tolerability of medications, those who can't take our medications for migraine, either because they're pregnant or there's other reasons, those that want to reduce their risk of medication overuse headache, or those that want to just reduce their overall migraine burden, which can then make some of our treatment options more effective. So to start with, we'll talk about some behavioral and lifestyle factors that can be helpful. So these are the healthy habits of migraine. I took this from the American Headache Society website. I think this is a good group. To start with sleep, we know that people who have chronic migraine are more likely to have insomnia. And so I do like to assess for any sort of sleep issues in my patients, and then making people aware that there are behavioral treatments for sleep issues, especially sleep disorders, especially insomnia. So if that's something you struggle with, don't think that the only treatment is medication. There are other options available. Mood, we know that people who have migraine are more likely to have depression or anxiety. And we know that there's a bidirectional relationship between mood and migraine, meaning if your depression or anxiety is worse, then your migraine might also be worse and vice versa. So if this is something that you think is applicable to you, making sure you discuss with your healthcare provider and that your mood's being treated as well as your migraines. Stress, we know stress is sometimes unavoidable in our lives. And it is a very common trigger for migraines, but there are strategies to help manage your body's response to that stress so that it can lessen the impact on your migraine burden. And we'll talk about some of those strategies. And then keeping a consistent daily schedule. You know, they say migraine brains really like routine. And so what that means is trying to get up at the same time every morning, eat meals at the same time, exercise at the same time, go to bed at the same time. As much as you can make those events in your day look the same day to day, that has been associated with lower frequency migraine. And because I think getting good sleep is so important, I think for everybody, but especially if you have migraine, I wanted to tease out some of these healthy habits for sleep. So I took this list from the Sleep Foundation website, and I think it's a pretty comprehensive list. So to start with your sleep schedule, so setting that set wake up time so that you're waking up within the same hour every day, regardless of whether it's a work day or a school day or a weekend, trying to be consistent. And then prioritizing sleep. I think this one's important. I know this one speaks to me. If you have a lot to do, housework or schoolwork or, a work project, that losing sleep or working into the night is not necessarily the best idea. That sleep should be a real priority for you as well. Because if you sacrifice sleep on one day, you might be setting yourself up to feel even worse the next day. So making sure that sleep's a priority. And then making any sort of adjustments to your sleep pattern gradually. So for example, if you're consistently going to bed at 1 a.m., if you try to get in bed at 10 o'clock tonight, you're not going to fall asleep. And so if moving your bedtime back is a priority for you or a goal you want to set, doing that gradually, maybe 20 or 30 minutes every few days or week until you start to fall asleep consistently at the earlier time, and then backing it up again until you get to your goal bedtime. And then just being conscious of when you're napping. Naps are not necessarily a bad thing, but if you're napping for longer periods of time, and especially in the afternoon or the evening, it can make it harder for you to fall asleep at bedtime. And so trying to limit naps to shorter periods of time and earlier in the day. And then daily habits to think about. Making sure you're getting exposure to daylight. That's a signal to your body that it is daytime and it's time to be awake. And then the vice versa is that in the evening when it's dimmer, when you dim the lights in your house and it's dark outside, it's a signal to your body that it's time to wind down for bed. Being consistent in a consistent like exercise program or exercising regularly, getting physical activity during the day can actually help you sleep better at night. And the one caveat to that is some people might find exercise to actually be stimulating. It gives you a burst of energy. And so if that sounds like you, then I would encourage you to try to exercise earlier in the day rather than later in the evening. But that can be helpful. And then some substances to think about. Caffeine and nicotine can be stimulating. So trying to limit that before bed. Caffeine, I typically recommend to my patients that they try to cut off their caffeine intake about 5 hours before their set bedtime to make sure that that's being metabolized out of your body and not interfering with your ability to fall asleep. And then some substances like alcohol, you might feel that it helps you sleep better, but as that leaves your body overnight, it can actually make your later sleep a little bit more disturbed. And so I would encourage you to limit alcohol. Dining late, I especially think of those people that might have like a coexisting like acid reflux or GERD, especially larger meals or spicy meals, especially greasy meals. If you eat that before immediately before you get in bed, it can give you or some of those GERD symptoms or exacerbate those symptoms. So if you're planning on eating a larger meal, a spicy meal, maybe trying to do that earlier in the day, or if you're having to eat later in the day, maybe keep it on the lighter side so it doesn't impact your ability to fall asleep. And then restricting your in-bed activities. So they say the bed should be reserved for sleep and sex, and that's it. And that is really to make sure that your body is associating getting into bed with relaxation and falling asleep. So avoiding things like scrolling your phone or reading or watching TV in bed, that your body's not associating being in bed with those awake activities. And then if it's within your control, trying to set up your sleep environment to be conducive to a good night's sleep. So making sure it's comfortable. And this can mean making sure that your mattress is comfortable. You like your pillows, the bedding's comfortable. Most people tend to sleep better in a cooler environment. So if that's within your control, about 65 degrees Fahrenheit is good for most people. Blocking out light sources. So that can be getting light blocking curtains for the window. It can be, shutting the doors, the hallway light doesn't bother you, turning off the lights in the room. If you have like an alarm clock next to your bed, turning the face away from you so that light's not in your face when you're trying to sleep. If you're in an environment that has noises, you might want to think about drowning those out, and you can do that with a white noise machine. They have white noise podcasts that you can use, or even something like a box fan, some sort of constant sort of background noise to help drown out those other sounds. And then some people find certain scents soothing, so things like lavender. So if that's something that you think would be pleasant for you, you could consider adding that to your sleep environment. And then the nightly routine. So really it's about consistency, like we've said a few times already, making sure that you have some sort of like wind down routine in place for the 30 to 60 minutes before bed, kind of shed the stress of the day, and really getting yourself into that relaxation mode. So that can involve dimming the lights in the house and avoiding electronics. So really the screens 30 to 60 minutes before bed. And then once you do get in bed, if you're not falling asleep and it's been 20 minutes, you're tossing and turning, getting back out of bed and doing something boring or calming or relaxing and dim lighting until you start to feel tired again, and then getting back in bed. So if you feel like insomnia is an issue for you, like I said, I would discuss it with your healthcare provider. And like I said, there are behavioral interventions, specifically cognitive behavioral therapy for insomnia, has some of the best evidence for successful treatment. And there is an app that's available that I've had some patients use and like. It's the CBTI Coach app. I put the icon on the right side of the screen here. So this is a free app. It's available for Android and iPhone. It was developed by the VA. And it's nice. It has a few different features. So it has a sleep diary, so you can track your sleep if that's something you're interested in doing. And it also has different tools related to the sleep habits we talked about, including a list of those kind of like relaxation, boring type activities that you can do if you can't fall asleep. So that can be nice to have on hand. And then also lots of education on different topics surrounding sleep. So now we'll talk about some migraine triggers. So another, behavioral factor in helping to mitigate migraine can be avoiding triggers if you know that you have them. There are a ton of different things that have been described as different migraine triggers. And so what I pulled out here are some of the ones that are more common and some of the ones that I think are a little bit more within your control, possibly. So one is emotional stress, like we've talked about. So really utilizing those relaxation strategies or good coping strategies. And then avoiding stressors if you can. So not all stress in life is avoidable, but some you might be able to avoid if possible. So I'm thinking like, if you hate going to the grocery store and you're able to kind of delegate that to a partner, family member, or even using like curbside pickup or online ordering, something that you might be able to take out your plate if it's a stressor for you might be helpful. Sleep disturbance, we talked about, really avoiding disruptions to your sleep schedule and implementing those good habits. We talked a bit about caffeine and alcohol already, just really knowing your limits and being conscious of how much you're consuming and how it might affect your migraines. Some foods are triggers for migraine. So if you've identified any of those, trying to avoid them if possible. And then we also know that dehydration is a common reason for having a headache. And one of the easiest ways to avoid becoming dehydrated is to make water readily available. And so if you carry a water bottle with you, that can be helpful. And then some environmental factors. So lights like fluorescent lights or bright lights from screens can be a trigger for migraine. So if you're able to either turn off overhead lighting, like fluorescent lighting in the environment that you're in, utilize like desk lamp or a floor lamp. And if you are able to avoid smells that might be triggering, that one might be a little bit harder to modify because you can't always control the perfumes and colognes people wear, but if possible, avoiding those. And then certain weathers can be more likely to trigger migraine for some people. So storm systems for sure, but also like hot and humid weather. And so if you know that that's a common trigger for you, maybe trying to plan your activities earlier or later in the day when you might be able to avoid the worst of that type of weather. So I'll move into some relaxation management strategies. So first we'll talk about progressive muscle relaxation. I like this because it's something you can do completely on your own, and it does have evidence that it can be effective in reducing migraine burden, also tension type headache. But this is something that's simple, it's free, you do it on your own, you don't need a prescription, you don't need to work with a healthcare professional. It doesn't take long, about 15 minutes, and you do this as frequently as you find helpful. Most studies, they aim for people to do it either every day or multiple times a week. Now, you can do this either with a written script like I have on the right-hand side of the screen here, or all the different meditation apps like Calm, or streaming services like Spotify or Pandora will have like guided progressive muscle relaxation podcasts that you can listen to. And there's also videos on YouTube that are readily available. So what this is an exercise with the goal of building awareness of where you're holding tension in your body, and then being cognizant of when you're releasing that tension so that you can sort of train your body to live more in that relaxed state. So it's a two-step process. So you take a specific area of your body, like the first on this list is your fists, and you would create tension. So like clench your fists while you're taking a deep breath in, and then hold that tension for 5 seconds. And then release the breath and release that tension all at once. And what you want to be doing is thinking about how it feels with that tension, and then how it feels when that area is relaxed, and noticing that difference. And you can repeat that several times in the same area of the body, using less and less tension each time. And then you can move on once you feel like you have a good idea of what that area feels like to be relaxed. So this is an exercise. If you're trying to fall asleep at night and you can't fall asleep, you might try the progressive muscle relaxation as a means to further relax your body and hopefully get you relaxed and sleepy. So then there's biofeedback. This you can't do on your own. This does require a trained practitioner. It does require specialized equipment. And this does have evidence, again, in migraine and tension type headache. So I like this quote, it's training, not treatment. So it's not necessarily treating a disease state, but it is training your body to exert, hopefully, some control over what were once thought to be like uncontrollable automatic responses within the body. So this is one of those interventions that can help with stress management, making sure that when you're exposed to that stress, you're not holding that stress within your body. So what this involves, it can measure a wide variety of things, but what comes up most commonly for migraine specifically is muscle activation, heart rate, respiration rate, skin surface temperature, and heart rate variability. And you're attached to these monitors. And then the results are displayed on a screen in real time. And then you and the practitioner are reviewing those results on the screen and then trying different interventions to hopefully change those responses. So it's a pretty interesting strategy. If this is something that you feel like would be helpful for you, there is professional association that allows you to search for providers. It's their professional association is the Association of Applied Psychophysiology and Biofeedback. So if you check out their website, they do have a provider search function. So then there's acupuncture. This is a thousands of year old practice that does have evidence in helping to treat migraine headaches. It is commonly used to treat a wide variety of pain disorders. And what acupuncture involves is insertion of fine needles into the skin. So it's not deeply inserted. And the needles are regulated by the FDA. They are clean, or they're sterile single-use needles. And when this is done, when acupuncture is done, administered appropriately, it's very rare to have any adverse effects from it. So I was interested, because this is not something that I have a lot of patients that have pursued. So I was interested what the licensing requirements might be, and it varies by state. So I checked for PA where I am, and I checked Utah where the headache school is based out of, and both states require that practitioners pass a certification exam and then get licensed within the state. So their credentialing body is the National Certification Commission for Acupuncture and Oriental Medicine. And again, on their website, they have a provider search function. So if this is something you're interested in, you can find a credentialed practitioner through their website. Then we'll talk about cognitive behavioral therapy. Again, evidence for efficacy in treatment of migraine. Some of the best results in research have been a combination of CBT and pharmacologic treatment, so medication, but you don't have to be on medication to utilize this. And CBT is used in a number of different pain disorders, but how CBT differs from like your regular talk therapy or psychotherapy is that it's really aimed about breaking patterns, so unhelpful ways of thinking, patterns of behavior, and teaches better ways to cope. And CBT can actually help with integrating other like wellness, relaxation, stress management techniques like we've talked about into your daily life. So it's based on this philosophy that the way you think impacts how you feel, and how you act. How you feel affects how you think, and how you act, and how you act affects how you feel and how you think, and sort of intervening in different ways to break that cycle. So what can happen with migraine is you get in this cycle of being in pain during the migraine event, and then after you're out of that migraine event, you might still be in a tense, anxious, stressed state, sort of waiting for that next pain cycle, which makes sense because migraines are awful. So of course you'd be nervous about another one coming, but it can help break you out of that in addition to hopefully decreasing your migraine burden. And what was interesting in some of the research that was done with CBT is some of the patient feedback, even if they didn't necessarily have an appreciable decrease in migraine days, patients were happy with CBT because they felt in that like migraine off time, since they were no longer, they weren't as stressed, anxious, tense, waiting for the next migraine to come. They felt like they got back time just because they were able to function better in between migraines. So again, they have a professional organization on the right-hand side of the screen here, and that does have a function to search for therapists specialized in CBT. So we'll talk about some supplements. So just a few caveats. These are substances that are absorbed systemically, so there are potential interactions with other medications, other disease states. So as always, please discuss with your healthcare provider before you would start any of these supplements. And just a little note about how these things are regulated. They do not require FDA approval. The FDA has some responsibilities that they laid out for manufacturers. So they say they have to have evidence that their product is safe. And what this means is that it's not any new dietary ingredient. And by new, they mean anything new since October of 1994. And if it's nothing new, they don't have to provide any additional safety data to the FDA. The FDA does say that the label claims have to be truthful and that they're not misleading, and they are allowed to make some health claims. So you'll see, I'm sure you've seen statements on labels that say like this supplement supports heart health or bone health or brain health. They are allowed to say that, and then it just has to be followed with that disclaimer: this statement has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. So we'll start with magnesium, which is probably the most commonly used supplement. This is thought to work by inhibiting excitatory neurotransmitters, so turning your brain from a more excitatory state to a more relaxed state. It's typically dosed between 400 and 500 milligrams per day. It's available in a variety of different formulations. Magnesium oxide, I believe, is the most readily available. It also comes in like chelated magnesium or magnesium glycinate. Some of them can be better tolerated than others. These potential adverse effects are the reason why magnesium can also be used to treat constipation. So it's usually GI side effects, abdominal discomfort, soft stools, and diarrhea. Then there's riboflavin. That's the name for vitamin B2, and this plays a role in energy production in the mitochondria. It's typically dosed 400 milligrams per day and generally well tolerated. I do like to let patients know that sometimes it can discolor your urine orange, so that's always good to know so people aren't concerned after they start that supplement. Then there's coenzyme Q10 or CoQ10. So this does have evidence of reduction in migraine frequency, and it plays a role in energy metabolism in the brain, typically dosed 300 milligrams per day and usually well tolerated. This one does have some potential medication interactions. So like I said, always discuss with your healthcare provider before you start any of these supplements. And then there's feverfew. So this one, interestingly, has evidence for decreasing migraine frequency and severity, but also potentially helping some of the associated symptoms with migraine, like nausea, vomiting, sound, and light sensitivity. So this works by inhibiting the release of serotonin and prostaglandin, and it's dosed typically 50 to 150 milligrams per day, usually well tolerated. But interestingly, because this does come from a plant, if you have a ragweed allergy, it's recommended that you don't use this because it can induce an allergic reaction, and it's also contraindicated in people who are pregnant. So now we'll talk about the neuromodulatory devices. This I really did just a very brief review. I took a peek at the upcoming headache school schedule, and it looks like there is a planned talk to review talk just on these devices. So if this is something you're interested in, be sure to come back and take a look. I'm sure that presentation will be great. So a few caveats before we talk about them. Costs, these typically are not covered by insurance and it can be expensive. I would say that's the main limiting factor in whether or not my patients decide to pursue these. Insurance coverage, like I said, is not great. If you have VA coverage, you might be able to get some of these covered. So that could be interesting if you're able to do that. And then these are contraindicated, most of them, if you have implantable devices like a pacemaker or an implanted defibrillator, metal, or shrapnel in your body. So at the top here is the cephaly. So this small device, the black device you can see on the screen, you actually have an electrode sticker that you wear in your forehead, and this device attaches to it, and it delivers an electrical stimulation to that trigeminal nerve to hopefully desensitize it and decrease pain. So the cephaly you can use scheduled as a prevention, and then also use it acutely, so at the onset of a migraine to hopefully abort the migraine. This one you can get without a prescription, so you don't need a written order to obtain the cephaly device. Then there's the Relivion, which is just like the Cephaly plus more. You can see in the picture, it's a headband worn around the head. There's electrodes that go across the top of your forehead for the trigeminal nerve again. And then in the back, 2 electrodes to hit the occipital nerves. So this is indicated for acute treatment of migraine. So you would put this on at the onset of a migraine to hopefully lessen the severity and length of attack. This one does require a prescription. Then there's the Nerivio. That's the top part of your screen here. You can see the kind of like gray vertical device goes into that armband and it's strapped to your upper arm. So it delivers electrical stimulation, but remotely, not directly to the head. And this you can use scheduled for prevention in addition to acutely at the onset of a migraine attack. This can be nice because it's a little bit less obvious than the Cephaly or the Relivion. So if you need to use it at work or at school, it's a little bit more discreet. Again, requires a prescription. Then the GammaCore, this device in the bottom here, you can see it has like the 2 metal prongs on top of the device. You put like an ultrasound jelly on that and then hold it over where you can feel your carotid pulse in your neck because your vagus nerve runs behind it and it delivers electrical stimulation to that vagus nerve to hopefully block pain signals. This you can use for prevention of migraine, for acute treatment of migraine, and you can also use it in some other headache disorders. So it's indicated for cluster headache, hemicrania, continua, as well as paroxysmal hemicranias. And again, does require a prescription. And then there's the Savvy Dual. So this one is not an electrical stimulation, it's actually a magnetic pulse. So they call it single pulse transcranial magnetic stimulation. So you hold this device, if you see the curved area, you hold it along the back of your head and then you press those 2 buttons at the same time. It delivers a single magnetic pulse through your head. So you can use this scheduled as prevention and in addition to as needed as an acute treatment. So that's is all I had for you today. So I hope that hopefully you found some tips that might be applicable. And I wanted to thank you for your attention.